Last year, for the first time, we held a forum on innovation in Medicaid. It was here at Glide on the lower level. We were hoping we'd get 50 people, 120 came. And so I said, how can we do more to push forward innovation in Medicaid? How do we scale solutions faster so that low-income people don't have to wait 10 years to benefit from solutions that could improve their health care and their lives today? And so as we sort of asked that question, I realized, well, one of the things we could do that would be really important would be to help the companies that are building these solutions, the innovators who are designing solutions specifically tailored to the Medicaid market. How do we help those companies to grow and to grow quickly? And that's the idea behind HealthTech for Medicaid.
In just a few short months, this organization has dramatically advanced, and today felt like a huge milestone to look out and see 500, 600 faces in the audience who all had this shared passion for driving innovation for Medicaid.
I think this organization is really important because it's shining a light on the need for innovation in Medicaid, so really allowing people to understand how important it is to be innovating for this population. Not just how important, but how much of a business opportunity this is.
I recently came onto the venture side because I think that fundamentally, in order to be able to really change the dynamic of conversations that we're having, even in places as wonderful as Glide Church, requires a massive investment. And there is a business community out there that knows how to make massive investments. And we could have existential debates about whether or not that is the right way that we should pay for social services in this country, and those are important debates. But the practical reality today is that the way that we do this and the way that we think about significant change is by taking big bets. And we need to take a really big bet in how we care for Medicaid populations.
I was the director of the California Department of Health Services, which meant that I ran Medicaid and took it into managed care. That was about 20 years ago. And for 20 years, I've watched people being frustrated. They want to meet the needs of the Medicaid population, and the resources aren't there. Digital gives us a possibility of really being able to meet those needs by enabling the providers, enabling the community workers that really can help them.
While there's a lot of problems to fix, the one thing you can't squander is hope. And for a long time, it felt like when it came to Medicaid, there was not a lot of attention, there was not a lot of resources, not a lot of innovation, a lot of folks thinking about how to make it better, how to make it faster, how to make it affordable, et cetera. And that meant that sometimes people who were either on the receiving end of care or those who were providing that care would lose hope from time to time. This event is about, for me, about resurrecting hope.
And now, after we've laid out the charge, some of the problems that we've identified in different markets, as well as some potential solutions, now we're looking forward to seeing the great minds of the audience and what they can bring to bear to take Medicaid forward.
I'd encourage all of us who are in the innovation and technology space to also remember that this is also about relationships and partnerships and working closely with the folks that we are intending to serve. The perfect app is not going to solve everyone's problem, right? It has to be thoughtful relationship building as we think about these technology and data interventions in doing our work.
Success for this organization would really be that the 79 million people that are on Medicaid get access to services that really improve their lives and make it much more accessible for them to get the care and treatment that they need for their children, for themselves, for their loved ones.
Before I give acknowledgments and thanks, I want to make sure that we thank the over 74 million people, over 14 million people in the state of California that are on Medicaid and CHIP services. We need to continue to give a voice to the people who let us provide solutions and care to the critical program that helps them. Let's not get lost in the world of data and technology and forget about the people that we're trying to serve.